Lung cancer is a complex disease categorized by the uncontrolled growth of abnormal cells in the lungs, leading to the formation of tumors that can interfere with normal lung function. It is one of the most common and deadliest types of cancer worldwide, with smoking being the leading cause of the majority of cases. Understanding the main risk factors associated with developing lung cancer is crucial for prevention, early detection, and effective management of the disease.
When we talk about risk factors, I would broadly tell them there are risk factors which you divide them into modifiable risk factors and non-modifiable risk factors. What do we mean by that? Modifiable means something which you can avoid in your life. 90%, or I would say 80 to 90% of the lung cancers are because of the exposure to certain substances, which could be tobacco in the form of smoking, chemicals, radon, asbestos, lot of things around us which we can avoid. Non-modifiable risk factors are our genetics. Suppose if we have a family history of lung cancer, if we have a genetics where there are mutations in our genes, we are bound to develop lung cancer. But in case we are able to curtail our exposure to some noxious particles, still you don't develop lung cancer. So genetics plays a major role as part of the non-modifiable factors for lung cancer.
Recognizing the symptoms of lung cancer is crucial for early detection and timely intervention, as the disease often presents with subtle or non-specific signs that may be overlooked. Where being aware of the major symptoms of lung cancer can help individuals seek medical attention promptly and improve their chances of successful treatment.
As a doctor, I can tell you most of the time when we get patients, the patients are already in the advanced stage. So early symptoms, what you start getting, the symptoms could be directly related to your lungs or they could be generalized symptoms. I'll start by mentioning generalized symptoms. Like you can have weight loss, which is unexplained. You can have weakness in your body, which is unexplained. You can have aches and pains all over your body. Then you can have very lung specific symptoms like a breathlessness which is beyond expectation, cough which is not settling down, a cough which is going on for weeks or months together. Sometimes you get blood in your cough, and a very important symptom which not many people know or they relate to is a change of voice, a voice hoarseness. A voice hoarseness can be a symptom of lung cancer because there are growths in the lung which is pressing on the nerve which controls your voice.
When it comes to treating lung cancer, the approach depends on various factors such as the type of lung cancer, its stage, the patient's overall health, and their treatment preferences.
See a patient at an early stage, the best treatment would be a surgical treatment, that you remove the particular part from where the nodule is growing and the patient becomes cancer free. Suppose if you see the patient in an advanced cancer, then you are looking at a combination of a surgery with a chemotherapy. And in case you have patients who are even more advanced or have got spreads all over the body, then surgery is not an option. Then we are left with options of chemotherapy, and now we have got an option of immunotherapy. Immunotherapy means if you have lung cancer patients where mutations are positive, these patients can be given immune-based treatment, which are more better tolerated and much more safer for patients as compared to a chemotherapy.
To effectively navigate the landscape of lung cancer, it is essential to have a comprehensive understanding of its key aspects, including its causes, risk factors, symptoms, diagnosis, treatment options, and prevention strategies.